A Spectrum Health doctor making national headlines last year after recovering from COVID-19 is sharing an unexpected side effect, not of the virus, but of his internet fame. He spoke to our Lauren Edwards about the bullying that he has received as a result of posting about his journey.
I work in the emergency department. I get yelled at by people all day. Like, I can handle. But the comments were pretty brutal.
An unexpected consequence for David Burkhardt after writing this post in November about his own battle with COVID.
In the Facebook post, I just kind of encouraged people to wear their masks, social distance, take it seriously because, it can hit anyone. I'm a healthy 28-year-old who runs 5 times a week.
The Spectrum Health doctor's post went viral, catching the attention of Governor Gretchen Whitmer, who sent him this letter of support and gaining widespread attention, including interviews on Fox 17 and in the national media. But he says he never could have prepared for the backlash he was about to receive.
People would be like, well, what about all the STDs he has? It's like, excuse me? So it's just, there were so many things that I would read that it was just, people were so desperate for this to be fake.
He was called fake, an attention seeker, his story fishy, some of the comments profane. People called his family saying that he's a hoax. Researchers say that this is sadly not uncommon, even before the pandemic.
I've heard of physicians who their address or their phone number has been posted, physicians who've been attacked on Yelp pages or reviews where their practice has been targeted.
Dr. SHIKHA, JAIN, and medical student TRICIA Pendergrast were a part of the team that researched harassment and cyberbullying against physicians. They found pre-pandemic, 1 in 4 physicians have been bullied on social media.
There was a Jewish physician that reported him being sort of trolled by people who would put Holocaust pictures in comments.
Since the pandemic, they say the bullying has skyrocketed. It's caused some physicians to close their accounts. However, they encourage staying on social media to keep proving accurate information.
And a part of the reason that our patients and our communities are really struggling with finding information that's accurate is because there aren't enough of our voices out there.
And hospitals and other doctors tend to support one another. There are support groups on social media, especially for people of color.
They have a group chat. They do Zoom calls. It's an entire community. And so that is what is really missing from the in real life spaces.
Dr. Burkhardt says he received a ton of support, especially from his family. But he says the bullying was worth it if it's gotten one person to wear a mask and practice social distancing.
If people hear that enough times, if it changes one person's mind, then it's worth it to be called a silly name.
In Grand Rapids, Lauren Edwards, Fox 17 News.
Yeah, really disheartening at a time where doctors need our support.